Hello guys, this is Sonu and today we'll continue or we will finish today about the opioid analgesic. In last time we discussed about the all opioid drug, all opioid analgesic drug. Actually that all drug was stimulate the opioid receptor, and today we'll discuss mostly about that those drug which block the opioid receptor or partially we can say partially block that some of drug which block some receptor. For example, we have three receptor, delta, kappa and mu receptor. So these three receptor, one drug for example that nalorphine. So nalorphine is block mu receptor and stimulate the kappa receptor. So like that drug we will discuss, and then finally discuss about the acute treatment of the acute poisoning. If the person has opioid poisoning on the time, which drug we have to give? That is the pure antagonist, that it's completely block the mu receptor, kappa receptor, as well as all opioid receptor. So let's discuss first of all about the you can see the classification that antagonist and agonist means this drug. Antagonist and agonist means this drug, one receptor is blocking and other receptor is stimulating. That is the agonist and antagonist. Next one, the weak mu receptor or partial agonist means this drug is also the same thing. It's antagonize the mu receptor and stimulating or acting on the other receptor. That was the kappa receptor. And the last one, that is the pure antagonist, that is the naloxone, naltrexone and naloxone. This is completely inhibitor or completely block the opioid receptor. That is used for the acute poisoning or any poisoning of the opioid receptor and some other poisoning also. So let's discuss first of all agonist and antagonist. So first drug, that is the nalorphine. Actually this drug is nowadays we don't use at all due to a lot of side effects, but just you have to remember that, keep in mind that this drug also belong to the opioid analgesic, but we don't use this drug. Also other name we can say analyl normorphine. So we can say synonym name or chemical name, that is the analyl normorphine, this drug. And this drug is the mainly act on the kappa receptor. So it act on kappa receptor and weak antagonize of mu receptor. So it's act on the kappa receptor and it's block, but not completely block, we can say very strongly block, just weakly block of the mu receptor. That's why this drug also we can say we can give to the as a reverse morphine, because morphine act on the mu receptor and this drug is blocking the mu receptor. So as a poisoning of the morphine or reverse action of the morphine, it can be helped, but we don't use nowadays due to a lot of side effects like this drug has psychomimetic effects. Mimetic effect means this drug is strongly psychosis. This develop the strongly psychosis. Then anxiety, hallucination, and some like delirium like effects. Due to this reason we don't use nowadays this drug. That's why we are not discussing very deeply about this drug, because we don't use. Just keep in the mind that this drug also belong to the opioid analgesic. Now let's discuss about another agonist and antagonist. That is the pentazocine. This drug is nowadays used even very widely. So about this drug we have to discuss. Pentazocine. This drug is the same thing. It also act on the kappa receptor, but it's very potently act on the kappa 1 receptor. As we know that kappa is subdivided into 3 receptors: kappa 1, kappa 2 and kappa 3. So it's act on the kappa 1, which present on spinal cord. which present on spinal cord. And very weak antagonize mu receptor. If you talk about the indication, this drug can be used as a chronic pain and like a chronic pain such as cancer pain and some other neuropathic pain, and as a pre-medication can be used. Pre-medication. This drug is well absorbed orally, but not well absorbed, we can say absorbed orally, but due to the first pass metabolism, so this drug is best way to give the like intravenous and intramuscular. And about the side effects, just like the morphine, if you know about the morphine side effect, then you can suspect that the same like the effects. And one thing also I have to mention, that these three drugs, except pure antagonists, they produce ceiling effects. It can be in a respiration ceiling effect in some other organ. So ceiling effect. First of all, what is the ceiling effect? Let's discuss first of all ceiling effect. So ceiling effect. Ceiling effect means, for example, if any person suffering from any disease, just guess that if person is suffering from typhoid disease, and that person need for the therapeutic, we can say therapeutic treatment, the patient need 100 mg of antibiotic. If any antibiotic, this is the normal dose. So if you're giving the 100 mg of antibiotic in a normal dose in those persons suffering from typhoid, so this value or this amount will reach in a therapeutic concentration, or we can say therapeutic level, means the 100 mg the person should be need this drug. But if you think or if you thought that if you give the 200 mg, means this is the normal dose. If you give 100 mg, the person will recover automatically if you give the 100 mg. So this is the normal therapeutic dose. But if you think that if you give the 200 mg, then person will recover very fastly, it means it's totally wrong. Means it will not any effect on the recovery, even it's 2 hours than the before the person or the patient, and it will produce a lot of side effects. It will very toxic effect, or we can say it's accumulate in the body and produce different types of toxic effect. This all in we can say criteria is belong to the ceiling effect, or we can say it is a ceiling effect. So ceiling effect means if you give the more than therapeutic dose, so this will not any benefit, even this will be start the side effects, or we can say it will be the accumulated toxic effect will occur. That is the ceiling effect. The same thing here, they produce ceiling effect if you're giving the more than normal dose, or we can say even in normal dose is prolonged use, it can be start, or it can be see the ceiling effects. So ceiling effect is there. And about the all effect is same like the morphine effect. So if you know about the morphine effect, that nausea, vomiting, also in a hormonal changes, GIT constipation, in a CNS sometime like sedative euphoria, these all effect. You can watch the previous video that I discussed about the all very detail about the morphine. So the side effects like the morphine. Then next one, that is the butorphanol. Butorphanol is nothing to discuss, because this drug the same similar effect like a pentoxacoin. So butorphanol is the same like the pentoxacoin. So we can say same like pentoxacan, but it has as compared to pentoxacan, it has low ceiling effects. Means it will not very toxic, or if it will be accumulated in a body, just little bit, and the rest are about the same like the pentoxacan. So now let's discuss about other group, that is the weak or partial agonist of the mu receptor. That is the buprenorphine. Buprenorphine, very long name. Buprenorphine. Buprenorphine. Actually, this drug is the very potent. We can say 25 times more potent than morphine. So this drug is very potent. As you see, that is 20 times more potent than the morphine. And this drug also weak, we can say agonist on the mu receptor, or very partial agonist. About the indication, about the side effects and contraindication, the same just like the morphine. So no need to, we can say, understand that what could be the effect. If you understand about the morphine effects, then you can, even all opioid analgesic, they almost the similar effects. So if everything about rest all like morphine. So we can say, so these three drugs with that the nalorphine, pentoxacan, butorphanol, and buprenorphine. This three drugs is not, we can say, good opioid analgesic, or we can say it's not typical opioid analgesic, because this drug is the some receptor binding and some receptor which are antagonizing. Due to this reason, even in nowadays, this drug is not drug of the choice for the as a opioid analgesic. Just you have to remember that this drug also belong to the opioid analgesic, and that this function. That's all. Now we'll discuss about very important, that is the pure antagonist or treatment of the acute poisoning, because this is very important, because the all opioid drug are physical dependence. Means this all drug is the, a person will start to take, it may be addiction, just like alcohol. That's why it's very important to know about the poisoning. If the person will addiction and will take more than normal dose, so it will be poisoning. Then how you will treat patient? Because we have a specific antidote of the opioid analgesic. So if you know about this drug, then you can very easy to treat the patient and save the life of the patient. So let's discuss about, first of all, just write the acute poisoning. Of opioid analgesic. So first drug is the naloxone. Naloxone is the very potent or competitive inhibitor of the opioid analgesic. So it's a potent opioid receptor inhibitor. This three drug is the very potent opioid receptor inhibitor, but it's a very potent inhibitor of morphine. Even in a low dose can be completely block the mu receptor. Then the kappa and delta. And as we know that morphine also very potently act on the mu receptor, then kappa and delta. That's why it's a very good, we can say, absolutely antidote of the morphine due to this reason. Next one, how you will give, first of all. One thing also, that how you will recognize that the person have morphine effect. As I said in last discussion, that the person has symptom of the poisoning. First, the very stupor behavior, then cyanosis will occur. Why cyanosis will occur? Because it's a prevent or lower the sensitivity of the carbon dioxide in the respiratory center. They will not sense well that the person has increasing the carbon dioxide due to the inhibiting of the morphine. Due to this reason, the person has hypoxia and cyanosis will develop. So cyanosis, mainly cyanosis you can see not all over the body. You can see the lip area, the nose area, the cheek area, eye area. Mainly in the lips area is cyanosis. And if it will be the prolonged time, if treatment will not start very fastly, then you will appear in the all over the body. Next one, that is the meiosis. Meiosis is the, we can say, good diagnosis, very important diagnosis, because in other any respiratory trauma or any brain trauma, it will be mydriasis, means dilation the pupil. Just in the opioid case, it's a meiosis, contraction of the pupil. That is the, we can say, good diagnosis. Then other is the, due to the cyanosis, increase the respiratory rate, or we can say that blood pressure, changing of the blood pressure, like it's decrease the blood pressure, or should be increased. Then the person has, I think this is the main information about the, you can recognize that the person is take opioid poisoning. So if you about this symptom, you already diagnosed that the person is opioid analgesic, they take opioid poisoning. Now you have to start the treatment. First treatment, that 0.4 to 0.8 mg in every 3 minutes. Every 3 minutes you have to inject by the intravenous or intramuscular, doesn't matter, but more best if you give the intravenous, it will be very faster recover, and mostly the intravenous. So 0.4 to 0.8 mg in every 3 minutes. Maximum 10 mg. Maximum 10 mg you have to give. But it's depend upon the person is how much they take the opioid poisoning. So if you are starting the treatment first 0.4 to 0.8 mg, then person will automatically recover, means they we can say respiration is good, blood pressure is normal, the cyanosis will disappear, the constriction of people will be disappear. So you have to very carefully monitoring the patient, and then you will be stop or decrease the dose of the naloxone, or we can say pure antagonist drug. Then even if you give the 4 to 10 mg, even this amount of the drug can be, we can say that this drug is the, whatever they have agonist function, they will be disappear, and they all completely antagonist in this amount. So if along with the pentoxacoin, if you giving that naloxone in this amount, as we know that pentoxacoin is the weakly antagonist of the mu receptor and act on the kappa receptor, so it will be strongly inhibit the kappa receptor, or we can say antagonize the all, and this amount. And about the side effects is not much side effect, but hepatotoxicity and nausea, vomiting, sometime hepatotoxicity. But mainly those patients who are suffering from liver problem is on that time it's obviously contraindication. But in a very prolonged use, hepatotoxicity or high dose can be sometimes hepatotoxicity. Vomiting, nausea, as you know, that's a common in all drug. So, and along with this drug, this is the, we can say, acute, absolutely antidote. But along with this drug, we have to some other treatment have to do also. For example, activate charcoal, that is the gastric cleavage. So this have to also should be done. then proper ventilation. If a person is prolonged, we can say they suffering or they took drug, I mean opioid poisoning, and then after 1 hour or 2 hours they start treatment or they start the antidote. So they will obviously too much accumulation of CO2 and they're suffering from hypoxia. That's why they need oxygen also. So oxygen should be done, and I think this too is a very important. Gastric levels and oxygen should be done, and also the monitoring the blood pressure very carefully, because if the blood pressure will not maintain, then it's also harmful, and pulse rate and oxygen level also as well as. So these are the main we can say that acute poison treatment. Next one, the naltrexone and the nalmefene. This through is just like similar to the naltrexone, but the I mean naloxone, but naltrexone is more potent than naltrexone. And the nalmefene also the same thing. It's also completely inhibitor of the all types of opioid receptor, but nalmefene is the less hepatotoxicity. We can say it has less hepatotoxicity, but it doesn't matter because this is the this drug used as a acute poisoning. So this drug will not very, we can say very regularly use. You will use in first time whenever the person will take acute poisoning. That's why in one time it will not see the hepatotoxicity and all thing. So this three is belong to the pure antagonist, means or we can say that is the pure antidote. Naloxone and naltrexone, these two drugs are very popular nowadays, even used. About the nalmefene is not a very widely drug which used in all over world, but you have to remember that this drug also belong to the opioid as a opioid antidote. So this all about the information about opioid analgesic, that we discuss everything about the introduction, about the main drug, and about the antidote and some drug which partially block the or I mean agonist and antagonist. So hope you will understand now opioid analgesic. In next session we will discuss non-opioid, that is the more popular than opioid, means it's quite popular in all over world. So we will discuss now I mean in next session we will discuss about the non-opioid drug. So till then, take care, and hope you will enjoy our video. So subscribe and like our video. Thank you so much.